Alright, so pardon the lack of video quality and pardon the humming in the background. That's the air conditioner going. I'm sitting in my backyard right now, which is not my normal filming location. So 2 months ago, the vet gave my dog 2 months to live. And she's doing alright, but I would not be surprised if she ends up going in a few weeks. Her name's Deja. She has cancer on her liver, and so basically the vet said that they could have operated and given her like 6 more months, but my family decided that it wasn't worth it financially for us. It wasn't worth it for the dog, because we love the dog. She's had a fairly long life, but anyway. So, which brings up, oh, thank God, my air conditioner stopped. So, all of this brings up, sorry, my screen froze for a minute. All of this brings up SCIT. SCIT is basically one of these natural cures for cancer that you hear about every now and then. These natural cures are a dime a dozen. So, every once in a while you hear somebody who's kind of, I'm going to give the stereotype, and for those of you who are very much proponents of these, please just pardon the stereotype. But you have basically a very hippie person or somebody who's not very educated in science. They have like this conspiracy theories that the doctors know that there's these cures for cancer, but they're making so much money off people having cancer that they want people to die so they can get the money while they're treating them. Now, whether or not you believe that's true, or to what extent you believe that's true, not really important. What's happening right now is my mom was researching SCIT, which is something that she learned from her reading is supposed to help treat cancer. And so we decided to get some of the stuff and give it to our dog. And we were concerned that she wouldn't drink it, but we've been mixing it with her water, and yesterday I mixed it with some milk, and she's been drinking it. She loves milk, and her behavior. Here, I'll put her on camera. As you can see, or maybe you can't see, but she's been very worn out. She's very tired. You can't really see the tumor on her belly right now because she's laying down. Not sure how well you could see her. You can actually see her ribs, but I'm not sure if you could see them very well with the webcam or not. But so far she's been drinking the stuff, and it's only been a couple days. She seems like she's doing better, but then again, people seem like they're usually doing quite a bit better just before they die. So I don't know how things are going to turn out. I don't know if she's going to pull it through this. We're praying for her, and you know what? Maybe it'll turn out this SCIT stuff is a miracle. And of course, all the disclaimers out there about with natural cures, you do have to be careful, because there are things like the placebo effect. Positive thinking really does have a very sorry, my screen froze again. Positive thinking really does have a very strong impact on how well people recover from sickness, how well a treatment works. That's why you have to do double-blind studies where you have thousands of people, because you got to find out, was it just the positive thinking, or was there something else the person was doing, like exercising, or perhaps they changed their diet. So obviously what we're doing with Deja right now would be only one step in a very large process. I guess I'll just explain really quickly because it's starting to rain. I did some research on the National Center for Biotechnology Information website, the NCBI website. Now what that is, it's a database with all kinds of medical information, all kinds of information related to biotechnology. So basically anything that is ever studied, any study that's ever done related to biotechnology, they post the article there, or they at least post the abstract with a link to the article. So you can do lots of research there, and apparently SCIT, after the anecdotal cases of people saying that they were treated with it, they did some research in vitro, so they did means they did it in the test tube they took tissue well, actually it'd be more in a flask, but that's beside the point. They took tissues that had cancer cells and that had healthy cells, and they treated them with SEACT, and they did find in vitro that SEACT has anti-cancer properties, and this is published in the mainstream literature. This is about as mainstream as you get. This isn't just, you know, some kooky flower journal out there. So that would be the real deal there. But the problem is they're not sure if that would translate into a adult animal, because a few cells in a test tube, even if they're from a person or from an animal, it doesn't necessarily mean the same thing happens in a full body. So you might have it where something treats cancer in the test tube, but it doesn't work when you actually give it to a patient. So there's a lot of research that needs to be done. I just thought that while we're giving the dog SEACT, I would talk about it on my webcam. So thank you for taking the time to watch this video. Apologies for whatever repetitiveness I would have had. Apologies for the quality of the video, but you know, it's a video journal, so what are you gonna do? All right, check out my websites, check out my other videos, and thank you for taking the time to watch this, and I hope everybody enjoys their day. This is Greg, out.